Hi, everybody. It's with distinct pleasure that the Stroke and Brain Aneurysm Center of Long Island wants to welcome you to our webinar, COVID-19 and Stroke Facts versus Fiction. We've been able to get together a tremendous group of specialists from the entirety of New York, a lot of the large institutions in New York, to give us their input on this extremely hot topic right now. As a lot of you know us very well, and the stroke is May Stroke Awareness Month, and the Stroke and Brain Aneurysm Center of Long Island normally would be on the road spreading awareness and understanding of stroke and cerebrovascular disease. However, COVID-19 has impacted us tremendously, as it has all of you in more ways than one. As a result of that, instead, we took it online to spread awareness, especially in the setting of a lot of information out there and a lot of news being produced in the setting of the pandemic. And before I jump in and start introducing our participants, I really want to tell you this is meant to be interactive. We welcome your questions at all times. And we want to hear from you. We want you to interact with our panelists. It's a great pleasure to have them. They're really a treat to have. And we really want you to ask any questions you have. A few housekeeping items. Please try to use the Q&A function of the webinar, and that will help us track your questions and answer. There's going to be some questions from us to you. We're going to have some polls. We're going to get feedback from you. We want to understand how you're thinking in some of the critical issues around COVID-19, especially since there are no hard and fast rules. And so everybody's experience is tremendously helpful. Lastly, I wanna acknowledge a lot of the people that are on this webinar today. Starting from my own institution, I wanna give a big shout out to all the hospitals of Catholic Health Services of Long Island that are actually represented here today. With Comprehensive Stroke Center, Good Samaritan Hospital Medical Center as one of them, also St. Charles Hospital, St. Catherine's of Siena, St. Joe's Hospital, Mercy Medical Center, and obviously St. Francis Hospital. I see a lot of the stroke coordinators, ER doctors, including progressive ER physicians, and a lot of the stroke specialists. And yes, I see a question. Yes, Rich, we will be recording this webinar and hopefully make it available for you guys later down the line. I want to also recognize, most importantly, our EMS providers who are out there seeing these patients first, and now they're participating in our webinar. They get exposed to a very hostile environment when it comes to the virus, and they put their life on the line every time, much more than us physicians in a much more challenging way. So I want to thank them and acknowledge their presence. Additionally, I want to tell you that I see the participation of most large health systems in New York City, and those are Columbia, Cornell. I see Mount Sinai, Montefiore, Stony Brook. I see colleagues from the entirety of the United States. I see colleagues from Europe, including Italy, France, Spain, Germany, Greece, vascular specialists and stroke specialists. I see tremendous participation from South America. And it's also with distinct pleasure that I want to recognize the presence and participation of the African Stroke Organization. They are participating in masses today, and they have given us an opportunity to work with them in the future, hopefully, and build upon today's experience. So without further ado, I want to jump right in and tell you a little bit about the framework on which we're going to build the presentation today. First of all, we'll describe the pathophysiology of thrombosis in COVID-19 and stroke. We will investigate the correlation between stroke and COVID-19. Is there an association between the two? Outline the management of stroke in COVID-19 patients. We have two great specialists who really will give us examples of both, and through some case vignettes, try to help us understand how to treat these people. And lastly, talk a little bit about all the complications that can be associated with this patient population, and in particular, the hemorrhagic complications. So our presenters, I'm going to start with Dr. Labropoulos. really a distinct pleasure to have somebody like him present here with us today. He is an expert in all things vascular across the body, but he has made a name for himself, especially when it comes to thrombosis and all thrombosis research surrounding a multitude of diseases, including COVID-19. I will be talking a lot about the epidemiology of stroke. I will be presenting data demonstrating the relationship between stroke and COVID-19. This is data that comes from our own health system with the help of my colleagues at the Dartmouth Institute for Health Policy and Clinical Practice. My partner in crime in the neuro-ICU, Dr. Ahmad, he will be talking a lot about the management and asking some insightful questions when it comes to issues of stroke and COVID-19. And lastly, last but not least, Alex Reynolds. It's really a treat to have her present here with us. She is from Mount Sinai, and she has been in the forefront of this pandemic, probably has the most experience than all of us in treating these patients and making decisions, especially when it comes to critical issues such as anticoagulation or other key decisions. So, I'm gonna first kick off this presentation with my end of the discussion, and that's more of a 30,000 feet view of, is there an association between stroke and COVID-19? And this whole thing started when we started seeing a lot of news and a lot of interest on whether there is such an association. Here are my disclosures. There are two fundamental questions really that we want to pose in this presentation. One is there an epidemic of stroke in young adults, as has been implied in recent media outlets? And second, can the course of hospitalized patients with COVID-19 be complicated by stroke? How did this whole thing start? Well, we saw a tremendous amount of media attention talking about the possibility of an association between stroke and COVID-19 in young adults. And that was fueled by a case report that was discussed that raised concerns about the possibility of such an association. Obviously, this spread like wildfire in the media, and we have, here Washington Post, CNN, and other outlets talking about this epidemic of strokes in young adults. However, this is not what we saw in the rest of the world. The rest of the world really spoke about a very different phenomenon. They spoke about the phenomenon of the decreasing in stroke incidence, what they call the vanishing of strokes and heart attacks. And so we saw data from Italy, we saw data here from Florida, data from China, data from the United Kingdom that demonstrated this vanishing stroke phenomenon. And as a matter of fact, the phenomenon was so severe that several media or several healthcare organizations created public service announcements imploring patients that develop stroke symptoms to come to the emergency room. And you see BBC News World Stroke Campaign, they're trying to get the word out there for stroke. And then more people started identifying this phenomenon of fewer strokes. And you see it in hotspots in the United States, here in Louisiana, in Chicago, in Washington State. And with that, I'm going to put a poll out there trying to see what you guys saw in your own practices. Did you see an epidemic, an increase in stroke incidence, or did you see a decrease in stroke incidence? And the question is, why can't we all agree? Well, I would argue it's a matter of perspective. Some of us see it differently depending on the scenario or the situation where we are and the data that we have. Because not all of us, all at the same time, excuse me, have the ability to see the full picture, the entirety of all stroke and COVID admissions. And I'm going to jump right in and try to answer the question by looking at the data in one single institution, the Comprehensive Stroke Center, the Good Samaritan Hospital Medical Center, the only comprehensive stroke center in the South Shore of Long Island. And the question that we have is, do we see more strokes in 2020? Just basically looking at the crude numbers, starting from January all the way to April, we actually are seeing a drop in strokes. We definitely had an explosion in COVID-19, but the strokes appear to be slightly less. What about severe strokes, strokes that needed an intervention, where those appear to be slightly less too? Is there a temporal pattern in these strokes? Well, let's take a look. Break down every month, January, February, March, and April, and identify really what's going on. This really will demonstrate for you the difference between 2019 and 2020. If you look around the time of March, and I'm going to point out with my cursor, with my mouse, exactly this area, you see that with the green is 2020 and 2019 is the red. You see this tremendous drop around March, and this is the same time, and I'm interposing a graph from IHME in Washington, demonstrating particularly for Suffolk County what the trajectory of the pandemic was, and this appears to be in the explosive geometric phase of the pandemic that we're seeing this drop in thrombectomy cases or the more severe strokes. And now let's take a step back and look at not just one institution, but look at all hospitals of Catholic Health Services of Long Island. And this is data that we've analyzed and submitted for publication with over 2,500 admissions for COVID in this time period, and over 24,000 general admissions for other stuff. So looking at this, these are daily discharges for stroke, TIA, MI, and COVID-19. And you can see that most of these lines remain relatively flat. They take a dip around the time that COVID-19 starts to come around. And then you see COVID-19 obviously is exhibiting this explosive growth. So really in this time frame, we're seeing that we do not really, we see that all other pathologies are relatively flat or declining, but COVID-19 is going up. If there was an epidemic of stroke as a result of COVID-19, we would expect to see this higher number of cases during the explosive growth of COVID-19. I'm going to take this a step further and try to see whether there is a correlation in a scatter plot. So we plotted the weekly cases of strokes and COVID-19, dark circles being patients over 60 and light circles being patients under 60. And obviously here we're trying to get to the question of the epidemic in young adults. So now if you were to see an epidemic of stroke and COVID-19, you would expect that more stroke would cause, or actually more COVID-19 would cause more stroke. So you would expect a line like this. But is this the line that fits the data the most? Or is this the line that fits the data the most? Well, I will tell you, if you do the numbers, if you do the math and analyze the numbers, these are the lines you get. The top line is for the over 60, the bottom line is for the under 60 years old. So you're seeing really no correlation or minimal negative correlation between COVID-19 and stroke, both in the over 60 population and in the under 60 population, more within the same lines of the story as the vanishing stroke phenomenon that's been reported all over the world. So what if we take it a step further and we adjust for the risk factors that typically cause stroke to see if there is a correlation between stroke and COVID-19 that's after controlling for all the other risk factors. And we did it with a logistic regression analysis, and we also did it with more advanced techniques such as propensity matching or inverse probability weighting. And you can see here part of the data in a forest plot. The forest plot really tells you there's just some of the variables, not all the variables used in the regression, because we controlled for hyperlipidemia, diabetes, hypercholesterolemia, smoking, coronary artery disease, and other risk factors that cause stroke. But you really see here that there is not a positive correlation, but actually a negative correlation. Patients with COVID-19 ended up having fewer strokes or there was a negative correlation rather between COVID-19 and stroke. But do COVID patients develop strokes? I would say the answer is absolutely. Multiple people have reported that you can have folks that have strokes and COVID-19 all at the same time. And in this report from China, we saw 5 patients in their series. That's a rate of 2.5%. And as a matter of fact, this is one of their images that they present. So these patients can have, obviously COVID-19 patients can have a stroke. COVID-19 does not seem to be causing a pandemic, but these people can have a stroke. Is COVID-19 an independent predictor of a negative outcome? Well, our data actually demonstrated that it is. We saw that folks that had SARS-CoV-2 infection and were having a stroke, their mortality was 10 times worse than patients that did not have COVID-19 and just had a stroke. So how do we answer these two fundamental questions that we posed at the beginning of the talk? First of all, I think our data demonstrated that there's no epidemic of stroke in COVID-19 patients, either young or old. But most importantly, yes, in an area, in a hotspot like New York, where, for example, 20% of the population is infected, you're expected to see some strokes in these patients. Now, a critical piece of information for us clinicians taking care of these patients is that these folks will have 10 times worse mortality as compared to regular stroke patients. So this needs to be taken into consideration when trying to make those decisions and these determinations. How do we explain this phenomenon of vanishing strokes and heart attacks and everything else? Well, we can only make suggestions, because right now we don't have the evidence, we don't have the pathophysiologic mechanisms that can potentially be contributing to this, but the suggestions or the speculations that we can make are fairly reasonable. I would say, first of all, we didn't see a lot of stroke for that small period of time where COVID-19 was explosively growing, partially because patients did not want to come to the emergency room. They knew the emergency room was overwhelmed with COVID-19. They wanted to stay out of that emergency room. On the flip side, patients did not also go to their primary care providers for their routine clinical visits. That came at a cost. Patients did not get their Coumadin regulated appropriately. They were not on the appropriate preventative measures to prevent a stroke. So as we expect to see a decrease in strokes around the time of the explosive growth of the pandemic, at least the less serious strokes would also obviously would try not to go to the emergency room. At the same time, we would expect to see a rebound from all these people that were not getting their routine health maintenance in the immediate active period of COVID-19. So understanding how the epidemiology of stroke works in this environment, we really wanted to create the appropriate response mechanisms for the stroke patients that are coming in and need an intervention from us in the endovascular world. And there's been publications out there, and this is from one of those publications that were suggesting that people need to be screened beforehand, but this has been really challenging for us for two reasons. One is we're in a hotspot, so a lot of these patients will have stroke, will have COVID or be asymptomatic, and we're not going to know until later down the line when all these folks are being tested. The real challenge is also with stroke. A lot of patients are unresponsive, they're aphasic, confused. They cannot really tell you if they've had history of viral illness or history of shortness of breath or fever. So instead of going through this path of screening, we went straight into treating every single patient as a COVID-19 patient. If they needed an intervention, they were intubated in the emergency room to prevent aerosolizing the virus in the angio suite, where there's a lot of materials where viral particles can contaminate. In addition, we created a very strict environment inside the angio suite with only one physician, one technologist, and one nurse, and outside of the room with a safety lead, a spotter, who helps people take on and off their PPE. And most importantly, these cases were all done with maximal PPE, wearing an N95 mask, face shield, and a full body, full sleeve body gown. So this kind of gives you an appreciation of how we responded in the acute phase of the epidemic to strokes that needed an intervention. Now, I know that Dr. Ahmad, who's going to follow a little bit later, is going to tell you a bit of how we envision this protected stroke code or the safe stroke code in the future, when we have the ability to do a lot more testing and trace patients better and identify where these folks are going to go. Are they going to go to a COVID-19 ICU, or are they going to go to a non-COVID-19 ICU? What's the appropriate disposition of these patients down the line? Now, with that, I want to really transition you guys to Dr. Labropoulos, who's going to focus a little bit more on the pathophysiology of thrombosis in these COVID-19 patients and talk to you a little bit more intelligently than me about how these relationships exist, and really help us understand in the folks that really get a stroke in the setting of COVID-19, what's the impact of the disease of COVID-19 on the endothelium, on hypoxia, and on thrombosis. And without further ado, Nikos, take it over.